What up, what up, what up? This is Jessie B here, back with another little short video for you guys. I'm trying to be more consistent, so here we go. This video is about tips for introverted hygienists. So if you were like me, you were nervous grabbing your patient in clinic for the first time. You were nervous about talking to patients. Even when you first started your real hygiene job out in the field, it's nervous trying to talk to patients, trying to figure out, what do I say? How do I get this conversation started? I understand. I get it. So I'm gonna just go over some things that help me out with getting to know my patients and just kind of like breaking the glass, trying to get to know people and not be so surface level with my patients. So first thing, and this is straight off the dome because like I live this life, I understand, is when you first grab your patients, just be smiling. You don't have to be, oh my God, hi. Like, you ain't gotta do all that. Just be like, chill, hello, good morning, how are you? You could talk about the weather, but I like to talk about people's outfits. I like to be observed. I'm in Atlanta, so if they have like a Braves hat on, talk about the Braves. You know, read up on your sports if you don't know a lot about sports, just to kind of get the ball going. I'm from Alabama. I graduated from the University of Alabama. So I always like to talk about Georgia, how we beat Georgia this past weekend. And so I like to say things like that. I like to talk about news, like say for instance, oh, are you close by? Did you walk here? How was the weather? Did the chemical plant did have a fire? I talk about the weather, whether or not they have asthma. That kind of helps me go over their health history as well. Just so that, you can kind of get the conversation started. Don't be so awkward. Also, like when I sit them down, as they're putting their stuff down, like their purse, their jackets, I like to say, what's going on? Anything changed with you? How was life? Anything medically happen with you since the last time you were here? That also helps them kind of just go over everything without you having to ask specific questions each and every time they come, just so that you kind of cover all of your bases at once. So as they're sitting their stuff down, Mr. Mrs. Johnson, whatever their name is, what's going on? Today you're doing a prophy today. Is there anything of concern that we need to address at this moment in time? They're like, nope, they're all good, cool. So I always like to say like, oh, we have just a perfect, healthy patient. They like to laugh. Some people say, well, I didn't take my high blood pressure medication today. We already got you. We're gonna take your blood pressure no matter what happens. So that's a good way to monitor them. So another thing that helps me get to know my patients better, and I just like to ask them, is there anything specific you would like to watch on TV? They say, yeah, I love HGTV. Bam, write it down, put it in the notes, so every time they come, you'll know exactly what they like. Okay, cool. So Mr. Johnson, today we're doing a prophy on you. Is there a specific flavor of prophy paste you would like? Oh, I didn't know I had options. What are the other options? Let me tell you. So we got mint, cherry, grape. Like you go down the list, and they like to hear options that makes the patient feel more relaxed, not makes them feel like everything has to be the same each and every time I come. Ask them if they're hot, they're cold. Would you like a blanket? I like to ask them if they're comfortable. Before I get started, is there anything that I need to be aware of, like sensitivity, any specific areas that might kind of bother you during cleaning? Is there a certain way you like to be cleaned? And I don't ask this for every patient, but when you can feel the vibe, when you feel like there is a patient that doesn't want to talk as much, obviously you'll see that. If they're quiet, they're kind of timid, shy, not really looking at you, then you can kind of like talk to them and try to see what's going on. If I do get a patient that comes back with me and they're very kind of short to the point, very quiet, I like to ask, are you sleepy? Are you tired? Is there something going on of concern that I can talk to you about or ease your mind about? Have you ever had a bad dental experience? Or even better, do you have white coat syndrome, which is something that even my own patients use? So if they do say yes, I'm like, well, I apologize. I'm sorry that you had a bad dental experience. And then I kind of go down the list of, and this does come with experience, I go down the list of how I like to take care of my patients. Like, I'm very gentle. If you feel very uncomfortable or if you have hot and cold sensation, we can give you topical numbing gel to help ease your cleaning. No matter what type of cleaning it is, I always want my patients to be comfortable. And that's period. Things of that nature really does help ease not only your patient but you, because you don't want someone jumping up and down in the chair, moving if they're uncomfortable. You don't want to force a person in the corner. You want to make sure everybody's comfortable. So super important. Just keep that in mind. It helps you also as a provider get more comfortable with your patients. So another thing that you can ask patients to break the ice is just asking about their oral care at home. Simple. It paints a picture for you, and it helps paint a picture for the patient, making them realize what they should and should not be doing. So instead of you saying, oh, you need to brush more, you need to floss more, you need to floss like this, they're like, I know I need to floss more. They already say it. So you're kind of already getting the ball spinning on what they need to do, and you're having a conversation with your patient at the same time. Super helpful. But I do like to kind of beat a dead horse. I ain't gonna lie. Like when it comes to brushing, especially, I love to say, please, if you are using floss picks, try to keep it to where you're only using them for food only, and not just to keep your plaque off of your teeth, because those floss picks are not helpful. The perfect thing, and I feel like I've kind of like mastered, is saying that floss picks are straight, your teeth are round. You cannot floss your teeth with floss picks because you're not contouring around the surface of the tooth, and you're not pulling off the plaque. You're just pushing plaque to the side because it's flat, it's straight. So you're not moving, you're doing this, you're not doing this. So most of the times when I'm doing an exam on them, I can already tell if the plaque is sitting on the incisal edge, on the interproximal edges of the tooth, like the mesial or distal parts of the tooth, then I already know they're using floss picks or they're not using the right type of floss. So again, just another thing that you can say, you can use to kind of have that oral conversation, also have a conversation with your patients. I do like to ask patients if they are married. I try to use the term partner just to be, you know, more understanding and politically correct. So when I do have patients, I'm doing their exam and I see flat teeth, I see attrition starting to happen, I do like to ask if they feel like they might clench or grind their teeth during stressful situations, or like if they're working out, or if they're waking up with sore tightness in the jaw, headaches. Those sort of symptoms do help me kind of lean towards this patient might be clenching and grinding. If they say no, they don't do it at all, then I go to, oh, does your partner hear you? Do they make a comment about when you're sleeping? I hear this grinding noise, that sort of thing. That helps you, one, get to know if this patient is married, and two, helps you try to figure out and paint a picture of if this patient is clenching and grinding. You will see signs. You will see like fractions on the teeth. Usually you have more bigger tori, palatal and lingual tori. So again, orally you're getting to know the patient, and you're also getting to know the patient. And so once you realize this person does have a partner or married or whatever the case, then I like to say, oh, how many kids do you have? Do you have any kids? Do you have pets? That sort of thing. I'm really nosy / observant. Sometimes when I'm looking at their clothes, I can see fur. So I'm like, oh, do you have a pet, a cat, a dog? And so while I'm doing exams and before I clean, I do like to ask if the patient has allergies. And if I'm nosy enough or observant enough and I see fur on them, I do like to ask any allergies. And if they say yes to cats and dogs and they clearly have fur on them, then I'm like, do you take anything? They're like, oh yeah, I take a Benadryl. I just love my pet so much. I'm like, okay. So then you get to know the person, and I love pets. So I like to ask them what type of cat. Is it like a calico cat, a short hair, long hair? Is it purebred? Like, where did you find it? Did you adopt it? People love to talk about their pets, y'all. Just ask them about their pets. But even if you don't care, just ask some basic questions just so you can, get to know them better. People really open up when you get a little bit more personal. Not too personal, but enough to like lean towards the things that they really care about, like the sports team, like their kids. I don't know how I did this, but I figured out a way to realize if people work from home or not. And then I asked people, okay, well, if you work from home, did you work from home before COVID, or was this a new thing? Are you hybrid? And they like to talk about that too. I said, do you enjoy it, or are you more of like an extrovert? Do you like to be in front of people or with people, working beside someone like that? If they're introverted, I asked, do you go to different workspaces? Do you go to like Starbucks, or do you go to Rome to do work? Like subscribe to a workplace where you can just do work from a different office. And so things like that really does help drive the conversation. They want to come back. They appreciate you giving them options. They appreciate you being more personable and asking about their pets that they've had for 15 years. Like, they love stuff like that. So, and it also helps you build confidence when you are learning more about the patient, and then you start to realize certain patterns. You realize like what people are interested in talking about, what they're not. And you want to be respectful, of course, but we're asking about your job, your pets, your kids, easy. And then you can also use their kids to see, hey, do they come here? Oh, I didn't realize you guys took kids. Now they can bring their kids here. hello, you're bringing more clients in. And so yeah, it's really cool to see yourself grow in conversation, because I used to be crazy about being scared to talk to patients, and I don't know, I don't want to scare anybody, but once you get to talking and they get to talking, you ain't gonna get no work done. So you got to be careful about asking questions. Just ask the questions as you're doing things that don't require you to be in the mouth. That always helps, like at the beginning, the end, when you're wrapping up, when you're scheduling, those sort of things really does help. I hope this helps you guys. I love you guys. Kiss kiss. I will be back for another short video. I will talk to you guys soon.